It's Women's Health Series this week with the lovely Jackie, and I'll bring her on in a second. Let's add her in. Today we're talking about all lovely stuff. Just trying to get this angle right. I'm balancing the selfie stick on. Hello.
Hello. Wanted me to go the other way.
Oh, of course.
Yeah. Alrighty. Hello. How are you? Oh, I'm looking very shiny there in the sunshine.
You look beautiful as always.
Dear. How are we?
Oh, good. Well,
yes.
we were talking. I know we were talking a second ago, weren't we? About me experiencing the early signs of labour. So this should be an interesting Facebook Live. If I have to suddenly just need to breathe for a sec. But fortunately, it's not that bad yet. It's just
early stage.
The early,
Exciting.
I know.
Oh dear.
Well. Anyway, thyroid today.
Yay.
It's our fourth day.
I know. My gosh, it's
flown
flown
quickly.
Yeah, it has. Yes.
Yeah. So we've had a few questions from yesterday, which I'll add in today.
Great.
So that we cover everything.
Okay.
So, thyroid. Now we know that it's a gland in the neck, just to explain to people, and it produces hormones to help regulate our energy.
Yeah.
But what else do we need to sort of know? Because I know that we mention about hyperthyroidism and hypo.
Yes.
So that would be amazing to explain the difference between those two.
Sure. That's right. And that's where it gets a bit confusing, because your hypothyroidism generally presents with a high TSH, and that's where people get a bit confused, because you've got a higher blood level, but it means you've got a low thyroid function. And then if your TSH is very low, you're more likely to have hyperthyroidism. And you can have both of these in just a symptomatic state where they're, too active in the hyper state or not active enough in the hypo state, or then they can both become an autoimmune version as well. So,
wow,
there's almost 4 different possibilities, I guess, with thyroid to a certain extent. So the autoimmune component is more when the immune system obviously attacks the gland, like an immune response, and that's when we get the Hashimotos or the Graves' disease. So Graves being the hyper and Hashimoto's being the hypo. So they're sort of, the different kinds that we're going to get. And then, yes, it will flow through and affect the whole body. So
that's a good point, actually. Yeah, I mean, the Hashimoto seems to be a prominent topic as well.
Seeing a lot of that, yes.
Yeah.
That's
Say
right.
hello, everyone. We just had a few people join. Say hi.
Hi.
Ask any questions today. We're talking about thyroid.
Yes. So I think what we need to remember is it's not just our thyroid gland. Yes, it does run our energy, but what I think people benefit from knowing is that every cell is run from thyroid hormones. So you think about all the cells throughout your whole body. If there's not enough thyroid hormone within that cell, we can't produce what needs to happen in that cell. So if that cell's trying to detox or form new cells or for hormone, your progesterones and your estrogens and things, if your thyroid hormone isn't getting into the cell to run the cell, then a lot of our cellular processes just don't happen. And this is where I guess thyroid runs into pretty much every single symptom we see, because it literally is the idle on the car, we call it, to run the cellular system. So, the hair can't grow, people's skin dry out because it's not replenishing the skin cells. There's gut stuff going on where the absorption is low. Pretty much digestive system can shut down as well in a thyroid condition.
So I think that's when it gets confusing, doesn't it? Because people are like, well, is it thyroid? Is it under? Is it over?
Yeah. And that's where, I guess we're at the point where we need to be clinically testing, a little bit better, because people are just walking away with a TSH and it's not giving us a full answer as to, what's going on in the body, what's going on at a cellular level.
Interesting. Because that's the standard test that you would get from a doctor, TSH.
That's right. And they're still not you know, really keen to jump on board the T3 and T4, let alone the reverse
So they're
T3.
the other ones. So if someone was looking to get properly tested by the doctor, what should they be asking for?
Okay, so, you know, yes, you want your TSH, but TSH is only a representation of what your pituitary in your brain is picking up from signals from the rest of the body. But what we, you know, see, and this has been found now, that if you're under stress, then your TSH level can look better than it is because your pituitary, your brain, is actually not picking up its stress. So it's not actually producing these hormones, you know, properly. So it's saying to the body, yes, we're fine. So TSH looks good. And that's where often we stop. But we want to obviously do some further testing. So we want your free T4, which is the first hormone that it should be produced, and your free T3. And then also potentially your reverse T3 and antibodies. So antibodies tell us if there's an attack on the gland, if it's an autoimmune version. And then the reverse T3 tells us if your body's pushing all the energy into this reverse T3, which makes us very fatigued and tired, and because it wants us to slow down and recover. But often, you know, reverse T3 is not picked up, and all the other levels can look okay. They might be borderline, but they look okay. But someone could have reverse T3 very, very high and be presenting with a lot of the thyroid symptoms, which is why it's been missed, you know, I believe so much, unfortunately.
I was going to say it must be a thing because I hear a lot of people saying, well, I've had the test and it didn't show up with anything. So my doctor's just like, well, that's, we can't do anything else.
Yeah. And I think probably majority of people, they're saying subclinically, you know, 70% of people are walking around with some sort of subclinical thyroid condition because, you know, naturopathically, we want it to be the TSH reading around 1.5 to maybe 2.5, whereas from a medical perspective, they're still generally saying, you know, depending on who you see, maybe under 6, under 5 is okay. So,
it's generally just the borderline, isn't it, for them?
That's
There's no
right.
other.
So in between that 2.5 and 5 or 6, people are going to feel pretty average. You know, there's always a stage before people get chronic disease where we're not going to feel great. So that's the window of people that are walking around undiagnosed.
Wow.
Yeah.
Okay.
Yeah.
What should people, the early signs, what will people be experiencing? And whether it's hyper or hypo, can you explain the symptoms just so people know?
Yeah, for sure. So hypo is the one we see more predominantly. It's I mean, we do see hyper, but generally speaking, hypo is probably a bit more predominant. So hypo is literally you feel like the batteries are running out. So we get this low functioning of everything. Sometimes it's brain fog, getting words out. You know, clarity of thinking can be really tricky for people. Muscle aches, fatigue, but not just your normal fatigue, that real exhaustion fatigue. So people know, people can feel the difference when they feel a different level. People often losing hair, eyebrow hair. You know, change in hairline can often happen. So if there's been a bit of receding or, you know, hair not growing back. The nails, anything that we're talking about with growth. So all your growth kind of can stop. And then obviously our metabolism slows down. So people feel really sluggish. They might be gaining some weight. They might be feeling bloated and a bit puffy. You know, anything.
That's quite similar to the PCOS symptoms.
That's right.
A lot of as well, which is why it's so tricky.
It is. And they all generally flow over to a certain extent. But I think, you know, it's probably the change in the fatigue and the trouble shifting weight that can be the first signs, I would say.
Okay.
That's happening.
So when you're hypo, you're more likely to be overweight.
Yeah, or maybe
struggling
to shift weight or slowly gaining over a few years. Would be. Or finally people start to try and shift weight. They might be, you know, taking on an exercise program and diet changes and they can't shift a thing. So then we start thinking, okay, why isn't your metabolism working how it should? Maybe the thyroid's, you know, sluggish. So, that's pretty much your hypo. And then your hyper is the reverse of that. So people often get high anxiety, perspiration, you know, almost people feel like they're running on adrenaline type feeling because it's all just been amped up. So sometimes they can have loose bowels because, you know, nothing can kind of hold in the gut. It just goes straight through. They're probably the main things we'd start to see at the beginning.
How would you know the difference then if it's hyper or adrenal fatigue? Because adrenal fatigue seems to be a prominent topic as well.
Yeah, I generally find with adrenal fatigue, with hyperthyroidism, they're generally not feeling the fatigue at the start as much, I would say. It will come because obviously that's an exhausting state to be in. But the fatigue with the adrenal side of things, they wouldn't necessarily, if it's full-blown adrenal fatigue, we generally don't see, we can still see some anxiety, but generally speaking, the exhaustion, the fatigue is going to be the big standout factor there with an adrenal problem. And the brain fog, probably more similar to a hypothyroid picture with the adrenal fatigue. It's more common to get people that are suffering adrenal fatigue and hypothyroidism. You know, the two kind of go together.
It sounds like because there's so much crossover between PCOS, adrenal fatigue, hypo, it's probably best just to go and get tested and then you understand
where we're starting, because that's the problem. You know, people are jumping on Dr. Google and somewhat diagnosing themselves. And there's so many crossovers into so many other areas of hormonal health. So it's good
and it can end up scaring you anyway if you just type in your symptoms and you're like, oh, everything seems to be cancer. It's like, that's not the case.
Exactly. We could have 100 things, couldn't we?
Yeah, exactly.
So,
anyone who's jumped on live, say hello. We've got a few more people. Please ask questions as we go because we'll be answering. And that would be amazing. Okay, so we've covered common signs and symptoms for people. Just take notes as you go because this is like information today. This is good. This is good stuff. Medications, like I typed into Google, Mr. Google, who said that
Dr. Google.
As soon as you have a thyroid issue, you need to take meds for the rest of your life, and you'll just have to deal with that.
Okay,
is that true? Or
so in a hypothyroid state where there isn't the autoimmune component, you know, maybe let's talk about that bit first. So when you're hypo and we know the body has the ability to make the hormones, there's just something causing a reduction, then I don't believe people need to be on that forever. You know, it can be something to give some relief, but what a lot of people still find is even if they get on the medication, they don't necessarily feel a lot different, I find. So we need to be aware that thyroxine is T4 hormone, and your T4 still needs to convert to active T3 to give you that good metabolism and good energy. So people with thyroid problems, if they're not seeing a result on thyroxine, the issue normally is a conversion issue, or which will go into multiple reasons why we can't convert our hormones. So it's, you know, I don't love keeping people on it long term. I like to sort of work out what's going on, get to the underlying cause. Maybe people are on thyroxine during that time.
Is it good for people to be on thyroxine for you to then tell if it's working or not, or that's not necessary?
No, not necessary. I'd much rather, if depending on where they're at, and this is going to depend on their levels. I mean, if someone was if someone was really, really high with their TSH reading, then we would encourage probably some thyroxine for a little bit just to give them some relief. You know, we need to make sure the clients are feeling comfortable. But if someone was maybe up to a range of, 7 to 10, and depending on how willing people are, it can come down quite well if people start looking after themselves and taking action with some thyroid stuff. Whereas with your Hashimotos, when there's the destruction, then that's a different story. Some people eventually get to the point where they have no gland left because it's been so destroyed. So yes, they often will need some thyroxine. But I do find people can still get through, some doctors, some T3. So your T3 is going to be your better absorbed hormone, and people often do better on a T3 hormone if they can get access to it.
Okay.
Where the results generally show up a lot better.
Right. Okay, makes sense.
So definitely not long term if you support the body, I guess, and fix all the underlying stuff.
That seems to be the case that we've spoken about throughout this series, in that you don't have to be on meds forever, and things are curable if you get your lifestyle right and your diet right.
Yes, exactly. And it's all similar stuff this week. I mean, obviously we've talked about different subjects, but you probably find that it all comes down to very similar principles. Sometimes different hormones depend on different things, but it's the stress, it's the inflammation, it's the gut, and it's similar to thyroid as well to a certain extent. So cleaning up.
I'm hoping people see that this week, that in the end it does boil down to the lifestyle, nutrition, whatever you're having, and so you can come out of it. So hopefully people come out with hope.
Yes, exactly. That it's not so overwhelming, and just get back to basics sometimes, and you know, kick off a few things each week, make new habits, give yourself time, and over time the body can heal itself. You know, we do see a lot of change and shift through diet and lifestyle.
Perfect.
Yeah.
Talking about that, what would you suggest with clients to how to control your thyroid naturally?
Yeah, okay. So it's, again, probably trying to work out what the underlying cause is. So maybe I'll just run through like a couple of things that can trigger it. So generally speaking, maybe we'll just talk about the hormone itself that gets made, our active T3 hormone that we want to be happening, that converts in our liver and also our digestive system, and some in the peripherals. So we want that conversion happening, but if you're deficient in, let's say, zinc, selenium, iodine, being, you know, a couple of the main ones, tyrosine, then your body can't convert that T4, so the thyroxine maybe that you're on, to the active T3 to get into the cells and give us cellular energy and, you know, digestion and metabolism. So we always would start by looking at, you know, signs for zinc deficiency. You know, is there spots on the nails? Are they having trouble with wound healing or colds and, you know, infections? Maybe testing their iodine through a urinary test, or doing a low dose iodine and see how they respond. Selenium I don't normally test because most people are very deficient, so a little bit of selenium through a mineral multi sort of vitamin. So that's generally where I start, is getting the supplements back in and the nutrients back in that we're missing, and then looking at this gut and liver issue. So probably 90% of thyroid clients that I see have underlying gut constipation, toxicity issues. So, you know, we do a lot of clearing out the colon and getting people to really understand what it's like to use their bowels properly and eliminate properly. And then following by looking at their history. So, you know, what their toxicity is like, how much makeup they're using, personal care, cleaning products. All of these things slow down the way your thyroid's going to function, and, you know, it doesn't like toxicity. It's actually very sensitive to most things we put into our bodies. And then in regards to food, you know, different conditions sort of call for different food eliminations, but thyroid's one of these ones where we say pretty much no gluten, ideally no grains. So the gluten, the gliadin in the gluten, if that gets over the gut barrier, then what we're seeing is it's actually a similar protein structure to what's in our thyroid gland. So all of a sudden you've got this gliadin running around the body, and the immune system marks it to attack it, and then it can also start attacking your thyroid gland because it looks very similar. So that can lead on to autoimmune thyroid. So, you know, clearing up the gut, making sure there's no leaky gut, so nothing can get through is really important. And really removing the gluten products in the diet is a big one.
It sounds like a lot going on there. Is there a sort of order that you would put people through?
I know, as I'm saying, I'm like, wow, that sounds a lot. And it's definitely a process, you know, and it'll depend on what the client's presenting with. So I think you need to, of course, think about for you, you know, what is it for you? Is it your stress levels that are high? Is it your gut symptoms that are high? And that's where we would kind of head first. Is it your diet that's really terrible? Head there. So, yeah, it depends probably for me when I'm seeing people which way I go, but in some order it would be gut and liver health, looking at stress, looking at our diet, and looking at any toxicity and inflammatory agents that are coming in. Or anything we're allergic to really is an issue. You know, any reactions we're getting to foods and things, the immune system and the thyroid doesn't like that. So that's probably,
I think that's super important, because people coming to you and then just asking a general question may not necessarily help, but you need to actually dig deep into their whole lifestyle and see what areas are causing the main issues.
That's right. And once we find that, you know, obviously it takes time to clean up that area or replenish that nutrient. But we generally know with thyroid, like I see people, I've got a lady recently and we've put on iodine, and, you know, her response has been amazing. She's just feeling so much better so quickly. And no doubt her iodine was probably quite low. We didn't test for her, but we just tried her on a fairly, decent dose. Iodine can displace heavy metals, so you do need to be careful.
Okay.
I'd always recommend probably using iodine with a practitioner, but or at least other nutrients perhaps. But it can give you a bit of a detox reaction, which is what we want. We want the body to clear out, heavy metals and stuff, which is, again, why we normally detox. Get that liver cleaned up and looking at the lifestyle and the toxicity.
Yeah. Hello. Hi, Lisa.
Hey, Lise.
Favourite subject, apparently, the thyroid today for Lisa.
Okay, excellent. I love thyroid.
Thyroid no-nos. If you know you've got a problem, what is it you just should not be doing?
Yeah, okay. So probably coffee is going to be one, unfortunately.
Oh.
Not the coffee. But we want to reduce the stress on the body, obviously, and the coffee is another stimulant, so that's usually an issue. And it also does take out, our vitamins from our body, so our zinc and our C and iron. Actually, the other nutrient is our iron in thyroid that we see a lot of issues with, low iron for women. So the heavy bleeds, and then that can turn to a hypothyroid state as well. So no-nos, the caffeine does need to go for a lot of people. And then we do need to look at the raw goitrogens. So we've heard about, the goitrogens that block the thyroid function. And that's like where soy comes into the picture. But we just want to make sure people aren't having too many of the kales and the broccoli and the cabbage, especially in a raw state, constantly,
Yeah, I bet you get that a lot. Like, what? I should remove kale?
Yes,
that's healthy.
Exactly. It's a tricky one, and I don't like to. I don't think we need to be ridiculous, but I don't want people having. I had some woman once, and she was having living on coleslaw, so it was all the cabbages and in a raw state, and it wasn't ideal for her at that time because we were trying to improve the thyroid function. Great for hyperthyroid to help slow it down, but in a hypo state, definitely not.
Wow, so that's super important for that testing then, because you could be eating something that's completely opposite to what you should be having.
That's right, exactly. I was just going to see what else.
For the no-nos.
For the no-nos. So alcohol, definitely. Anything, because we need to remember it's whatever slows down the gut and the liver. What have I done there?
And causes inflammation.
Exactly. So, if we're slowing down the liver function, we're not going to be making our active T4. So anything that your body has to process, if you're having coffee in the morning, putting on some makeup cleaning products, and then wine at night, your liver is very, very busy each night detoxing those things out and no time to make our thyroid hormone. So, you
just don't think of those things, do you?
We don't relate. Thyroid's up here, liver's down there. It seems so far, but it makes a huge difference to how we're feeling. So it's, the no-nos probably is finding, again, your inflammatory agents. So cutting down the chemicals in your life and the stress, because the thyroid is sensitive, to our stress. So like everything we've talked about in the last few days around stress and self-care would fall into that banner. They're probably the main, and the grain sort of gluten-y side of things would be the one food I would always say to people, gluten's really got to be either super minimal or ideally none if you want to get good results with healing with that. And once people have, maybe down the track, once we know that there's not leaky gut there, a small bit here and there might be okay for people. But
because I get the feeling that people struggle with removing something forever. It seems to be very intense.
It is. And I think what often is a good test is take it out for a month or two, see how you feel, put it back in, and most people notice the joint aches, the muscle pain, the foggy head. All of a sudden it's like, oh, actually that made me feel terrible, and maybe I won't go back.
You can kind of weigh up the options whether do I want to feel like this, or am I okay just removing gluten?
Exactly. That's right. The other thing worth mentioning there that blocks thyroid is high estrogen. So these women that are struggling with an estrogen dominant situation are more likely to have thyroid problems as well. So, and this is where the symptoms tie in, because obviously, a thyroid picture and an estrogen dominance picture can be similar, because often we're getting this flow on thyroid, sluggish thyroid effect from the circulating estrogens in the body. So And that's, but it comes back to gut health. Most people have got high estrogen because of their gut and their liver. So if all else fails, start there.
The amount of times people come to me asking me questions, I'm like, it'll be your gut.
Yeah, exactly. If all else fails, start with the gut.
Exactly, yeah.
And then we've got the halogen toxins. So people don't realise as well our bromide and chloride, so your swimming pools, fluoride in our drinking water and toothpaste, and even your fluorescent lights can offset some toxicity for thyroid conditions. Bromide is in like, I think it's the lining of, I can't remember, I have to look at that. Anyway, look up bromide, find out where that's in. And also the chloride in our salt. So if people are adding too much salt or having too much salt in their diet, then that can block thyroid function as well. So, we learn about salt being good sometimes, and people are like, putting Himalayan salt everywhere. But at the end of the day, it's pretty much 90% chloride. So it's still sodium chloride that's going to block thyroid. So watching your salt intake can be important.
What about the iodine for salt? You mentioned that if you're deficient.
And that's the problem often. I mean, we don't necessarily have, the iodinized salt now. A lot of people don't necessarily use that anymore. So we try and separate the two in the sense of look up your iodine foods, try and get some of those in. But really, I think if there's a thyroid problem, most people probably would need a supplement maybe to get their levels up for a couple of months. Just to boost them up a little bit is a really nice way to do the iodine. And most doctors are fairly open to that. Like I find if you mention that, if not, there's obviously private labs that you can do it through. So if people aren't sure, they can always get in contact and I can refer them to a place that can do private labs.
Okay, fab. Sounds good.
Yeah.
Bringing it back to what you mentioned about soy. Now, a lot of people are trying to drink things other than dairy and they're replacing all of it with soy milk.
Yes, exactly.
What are your thoughts on soy?
I am fine with people having fermented soy. So, your tofus and tempehs in not too ridiculous amounts. Maybe
not processed soy.
Exactly. Processed soy, the GMO, that's where we're having the issue. So soy milk, definitely not, especially if there's thyroid stuff going on. And again, if you didn't have thyroid problems, don't freak out about soy in your soy milk, but just, moderate and maybe, watch your symptoms. And if it's going to be a long-term situation, maybe think about swapping to like a coconut or an almond or something that's not going to give you a long-term impact.
Yeah, so Lisa asked about if almond milk was okay. And for me, I'd say check the packet first because some of it's highly processed almond milk.
Yeah, it is. And that's usually the stuff that tastes the nicest. There's a few lovely ones out there. And it's like, exactly. Check the packaging and just make sure there's not too many ingredients, what they're mixing it with. And, because it can be a bit of a toxic chemical just in there and some extra sugars that we need. So, either making your own or getting back to basics with some of those organic ones. I generally find the ones that are organic tend to be a little bit more on board with knowing what to put in there. So I tend to recommend people
for sure.
Yeah, exactly. Yeah.
I'm always a bigger fan of the coconut milk.
Yeah,
just
same
purely
here.
because it's more in its natural state than any of the others.
Yeah,
and it's a good fat.
Yeah. I just buy actually now just the cans without the plastic lining and just blend it with some water.
It's cheaper as well.
Exactly. I can, for sure. So, and I don't use a whole, if you buy a whole one, often you don't use it up within the time frame. So just a bit more economical. Yeah, so I agree.
Lovely.
Coconut
nice and
milk.
Creamy.
Yeah, good for some oats or something as well if people do that.
Oh, yeah, definitely. That's a fan.
Yeah.
Okay, soy milk, cool. We covered tests to ask because that was one question. It was the TSH, the T3 and the T4.
Yeah. Reverse T3 and your antibodies would be the full profile panel. But you can struggle with getting that because, unfortunately the doctors haven't quite, and I've spoken to many doctors about this, the Endocrinologist Association just, they're not saying it's important. So that's where we're at with some of the doctors. There's a lot of great integrative doctors that will do that.
Yeah.
And you can also now order thyroid through urine. So on the Healthful website, we do have some links there with where you can do a full panel through a urine test. which makes it a bit easier. So you can get it obviously delivered to your home and just freeze some urine and send it back to the lab.
Lovely time.
Exactly. Things we do. So there's possibilities. You just got to do a bit of a digging, I guess, as to getting your own testing and that sort of thing. Because it can be challenging through normal GP, which is fair enough, because there's a lot of us going now asking for a lot of tests, and you know, obviously Medicare, you know, coming down on that a little bit, which is fair enough. So they want to make sure that people need the test.
It's tricky, isn't it? Because doctors, they help with acute problems. I would always say go and find someone like you for chronic issues, because they're just more experienced in it and they have the testing to go with it. And doctors are great in other areas.
Yeah, for sure. Not the holistic underlying, you know, we want people recovering from situations, not being like
preventing illness,
medicated and just see you later. And, you know, thyroid, we didn't really cover this the other day in fertility, but thyroid and infertility issues are just, you know, huge. But if there's not that understanding to check everything, then, you know, it can be undiagnosed infertility for just a thyroid reason, which is really sad, considering how many women are struggling with that now. So
definitely. But this also is amazing that it gives you hope, because there's actually so many things that could be underlying with infertility that you could just rectify pretty quickly.
Exactly. So true. And I'd love to see the figures on, you know, who is actually properly infertile, taking away all these other health conditions. Because you know, I'm sure the numbers would be a lot less. If
I agree. Because there's so many young women, young couples who it's unnecessary for them to.
Oh, it's crazy. And they're spending, you know, obviously, unfortunately, a lot of money through different specialists. To go through
IVF
all this.
And things.
Yeah, exactly. So I think, you know, the education needs to reach a little bit further on that end.
Yeah. Well, we're doing our bit. We'll share this around.
Yeah, that's it. Spread the word.
Spread the word, everyone. That's no problem, Lisa. Good tip. We had one other question on adrenal fatigue and thyroid issues. We covered it originally a little bit earlier.
I can cover off on that if you want, in the sense that
would be good.
The main thing we want to know is that when they work together. So all of our glands, so if you had, you know, the cold hands and feet, the dry skin, the sluggish weight, if you had all those things, definitely. If you were, you know, you're not having any issues with weight or hair or digestion, but you're just extremely fatigued, then we'd probably be looking at the brain adrenal axis, you know, just supporting the stress and the but there's not much way the thyroid can get away with it. It's going to suffer to some extent if there's adrenal problems. It doesn't just kind of remove itself from the situation. They all tell each other how they're feeling, and
they all
kind of go down together, unfortunately. Once one's down, they just tell the next one.
Ship.
Yes, unfortunately.
Okay, amazing. Was there anything else that you wanted to make sure you covered? Like, I've covered these questions for people.
If
anyone else has anything?
Probably just still that conversion. I think people need to know that, like, the conversion from that T4 to T3, the things that inhibit that are your stress, poor gut bacteria, poor liver health and toxicity and deficiencies. So, you know, let's get away from thinking just about the TSH and even your T4 reading. We really want to know how well that T4 is converting to your T3. And there's a few ratios we can use to look at that. But we really want those levels in the upper end of your blood test. So if you've got those bloods done and you're looking at your results, you know, get them out and have a look. And, you know, we really want them high ends. We don't want them just borderline T3, T4 or a little bit below. You know, the higher the better, generally speaking, as long as they're not through the roof and the other way, for a hypothyroid situation. So it's a lot of time it's about the conversion issues more than anything, and getting that into the cell properly, and you know, going back to cellular health. So making sure that we're doing all those good things to support our body through a clean diet and
all the basic stuff.
All the basics. And realizing it can take time. You know, giving yourself, it sounds a long time, but 6-12 months. You know, to really do the process and give yourself some time to heal, and not just thinking I'm going to do it for a couple of weeks and then I don't feel better, so it mustn't be that, or it's not going to work. You know, there's a lot we can't see in our body that's going on. So
But when you weigh it up, some of these people have been dealing with it for years. So a year out of that whole length
you would hope
is nothing.
exactly.
And you'd start feeling better. You'd start feeling better pretty quickly, wouldn't you?
I noticed
you just
most
carry
people,
on.
within about sort of 8 to 12 weeks, like you would be seeing some signs. And it would depend on how chronic the situation was. But in mild subclinical, you know, maybe within 2 to 4 weeks, if you got rid of your actual triggers, you may be feeling quite a difference. And that, you know, that fog lifts, you know, you feel a bit brighter when you wake up. Some of the aches and pains are gone. So it can be quite quick if you clean up things pretty well.
Amazing. And I like that you provide tests on your website, so we'll just pop the link in below for if you wanted to just check.
And if anyone's got anything that they want to test for, you know, it's hard for me to put up every single test online, so I always encourage people, if they've got something they want to test for, like I've got access to the labs there, so we can always write you a script for whatever people are wanting. And you can just send me an email and let me know what you want, and I can, you know, sort of give you a quote or an indication on price. And that way, if you get stuck on where to test, there's definitely options.
Amazing. And you've also provided us with a lovely free gift on thyroid, and like kind of the helpful
some of those things, to go through some of the nutrients, where you get the nutrients from in your foods, some of your dosages. You know, good places to start with things. And, you know, I think that's a nice checklist to just have people go through and have a reminder as to where to start, for sure.
Definitely. It's a handy little guide. So if any of you want that, it's free. Jackie's provided it for you. And it's on Bitly, which is bit.ly /podcast vault. And I'll drop the link below as well. But there's also freebies from the rest of our series, from the hormones. And we've got a lovely temperature chart to gauge for your ovulation. There's some good
hormone
stuff in
tips. That's it.
Amazing. Okay.
Excellent.
If no one's got any other questions, thanks for joining us live. And we'll be good to go again tomorrow. Hopefully. It might just be Jackie tomorrow, but we'll see. We'll see how I go.
Hack your account.
But tomorrow is our final one. It's on menopause. So I already have questions
fabulous.
coming in about menopause. So excited about that one.
Awesome. All right.
Okay.
Excellent. Good.
Thanks so much, Jackie.
Thanks. Lovely.
Thanks, everyone.
Thanks,
Bye.
guys. See ya.